Hello, folks. Welcome to the March 4th Maine EMS biweekly COVID-19 update. My name is Jason Oko. I'll be your virtual host for this meeting. We're going to go through some ground rules for the meeting here. Everyone is muted. You don't have the ability to unmute yourselves. If you do have a question, please put it in the chat for us. We also ask that everybody leaves their video off. It just helps with the bandwidth for the meeting. Put your questions in the chat. If you can't use the chat because you're phoning in, you can text us your questions. The number to text us your questions to is 207-370-2072. That's 207-370-2072. And this meeting is being recorded, so it's going to be available later on the Maine EMS YouTube channel. Please, if you have the opportunity to, we'd love it if you would subscribe to our channel and also hit the subscribe button. So every time we post new content there, you'd get notified of the that new content being posted. So without further ado, I'll hand it over to Director Hurley.
Thank you so much, Jason, and good afternoon, everyone. And once again, thank you so much for joining us today and this afternoon on our bi-weekly conversations to discuss the status and the ongoing response to the COVID-19 pandemic. As always, I would like to express my sincere and deepest gratitude for all of the hard work that you and your colleagues are investing on a daily basis in this response. I understand that it is exhausting, and it's tough. It's tough. It's really, really tough. And I don't say that lightly or flippantly. That this eats away at you, this continued response, and even for our vaccinators, as vaccines come into the state, this the idea that, oh well, I've been vaccinated, so it's going to get better instantly, and that realization that it's not. Unfortunately, this takes time, and it doesn't fix overnight, and it will take time for us to move back into what we consider some normalcy. I do believe that in the end of following this, we will find a new normal. There will be a new normal. We will not go back to where we were before completely. I believe there will be a new normal. But that's tough. Change is tough. And this continued vigilance and response and fear is tough. So for that, I want to express my sincere gratitude with everyone for your patience and continued dedication to the efforts that we or that you all are investing. As I always do at the beginning of these meetings, I want to reiterate the paramount importance of you focusing on the mental health of your clinicians. As I just alluded to, this is tough. And so making sure that your clinicians and you and other members of your organization and your families are aware of the assets and resources that are available to support you is really important. This wears away at you and eats away, and it's important to stop and take a moment. And I know I will tell you I am a hypocrite, but if there ever was one when it comes to this, because as many of you probably know, I send emails at midnight working on stuff because it's my job to serve you, and I want to make sure that I am meeting those duties and that I am delivering on my promise to you to do everything in my power to support you. And so, but that all said, it also is just as important that you take time, and when you need support, when you need help, know that those resources are available, whether they are within your department via peer support, whether they are regionally with the CISM teams, whether they're statewide with the Maine Frontline Warm Line or other statewide resources, or they're national with national hotlines and other resources that are available. Please recommend to your staff that they take avail of those resources and they use them. They're there for them. Someone is paying for them, so use them. Don't let them sit there and collect dust when they're out there. And I know people are having a hard time with this. I know they are. So just keep that in mind, and I hope you will continue to deliver that message to the people you work with on a daily basis, because it is so important. So important. Thank you, Jason. So the hot button topic lately for every conversation it seems that I am on are ongoing vaccination efforts. The president directed the states to really expand education vaccination efforts, and as many of you are aware, the governor did agree to expand vaccination efforts to 60 plus individuals, as well as those who work in the education field. So that is good news. We are excited to hear that. But that also comes with a significant amount of logistics, as there are thousands of teachers in the state of Maine, and figuring out how they're to be vaccinated. They are going to be vaccinated is something that Maine CDC and DHHS are trying to wrap their head around, and Maine EMS is doing everything we can to support them. But as I've told them, this is not my war nor my battle. I'm just here to support with infantry and artillery. And so um, I want to make sure that people know that these aren't necessarily my decisions to make as to when we vaccinate people, when we don't vaccinate people, and how we do it. Those are CDC's decisions to make, and I'm here to support them and help facilitate those conversations with EMS agencies that are participating. A special thank you to some additional EMS agencies that have elected to start to join the vaccination process. Um, we are excited to bring those new vaccinating agencies on board. If there are any additional aid organizations that would like to become a vaccinating agency, please reach out to us and we can assist you with walking through that process. I will tell you that from what we've heard, there will be limited quantities of Johnson & Johnson vaccine for the next 2 weeks. And then there likely will be somewhat of a windfall of Johnson & Johnson, so a large quantity that comes in approximately 3 weeks. Those doses and shipments, Maine EMS, Maine CDC, Maine DHHS, the governor, no one has control over them, but we know that makes it extremely difficult for vaccinating agencies and other organizations to plan ahead for vaccination clinics and efforts, because you don't know what you're going to get. We do our best to get that information to you as soon as we have it available. Usually that's Thursday or Friday the week before. But the reality is sometimes we don't have it then. It's when the decision is made at higher levels than us, and then they tell us this is what you're going to get. I know that with the ongoing vaccination efforts and the expanded scope of vaccination efforts with our education partners, there has been a lot of movement of vaccine lately. And, that is really to try and accommodate the vaccination efforts throughout the state. One thing I will say is, from what I have been told, is that the priority is to vaccinate 60 plus persons and teachers who are 60 plus, and then other teachers who fall outside of that range. But when it comes to teachers, to prioritize those 60 plus persons, just because we have very limited numbers of vaccine. We don't have enough doses in the state to vaccinate all the teachers all at one time. So if if they were deciding between teacher A and teacher B, and teacher A is, 67, and teacher B is 22 and just got out of college, they're asking, like, let's prioritize the one who has the higher risk of morbidity and mortality, which would be that 67-year-old teacher, and to make sure that we get them into arms but that we don't sit on vaccines. So that was just the general guidance. No one's gonna come out and hunt people down, but we want to make sure that we are utilizing the vaccine to the best of our abilities. And again, if anyone is interested in becoming a vaccinating agency, please do not hesitate to reach out to us. As far as who will be vaccinating, that is all being coordinated by Maine CDC and the Department of Education. So that every school district is being assigned to a vaccinating organization. Most of them are being assigned to mass vaccination sites in their vicinity, or FQHCs or other entities within their catchment area. That said, there are some places where there isn't enough throughput volume, or there isn't enough capacity within those organizations, and so they have reached out to EMS agencies to help support and augment that. And so that is how that is working. And no, the teachers are not going through the pharmacy program. They are going through hospitals and the existing clinics that are established, not through pharmacies. Pharmacies are vaccinating seniors still in senior living and assisted living and those types of places. And unless there's something changed since this morning at 8:30, very well possible. I feel like if the wind changes a little bit, something might change. So, but that is what I heard at 8:30. And so there are some EMS agencies participating. There are some EMS agencies in more rural areas that have agreed to pick up, 20 or 30 teachers in those areas, because the commute is, 2 hours to their designated vaccination site. And so those people are working independently with us to coordinate those vaccination efforts. So I believe that's all the major updates I have on vaccination. Again, if you're interested in becoming a vaccinating site, please let us know. And then we know that there are some getting out of the business. I did on the board meeting this week speak to insurance concerns and reimbursement. We know that agencies are getting frustrated because the reimbursements have not been finalized and come through yet. We continue to place pressure on insurance agencies. It's out of our hands at this point. We have done everything that we have been asked to do. And we have enlisted the help of the superintendent of insurance to begin putting pressure. And today they are calling, the superintendent himself is calling each of these agencies to put pressure on them to make this happen as soon as possible. So I just want to tell you that we are pressing buttons on the other side to say, hey, this needs to happen now. I know that gives people a lot of heartburn, as currently in the state of Maine, there's about $315,000 worth of administration costs for COVID-19 vaccine that EMS agencies are floating right now across the system. That's a lot of money, especially when some of our systems, that's more than some of our systems' operating budgets, I feel like, especially in some of the volunteer agencies. That's certainly more than their operating budget. And so this can't go on and is not sustainable without them stepping up to the plate. So, but we are pressing those buttons. We also have engaged the Commissioner of Health and Human Services and others to really make sure they do everything they can to move that along. I will try to hit some questions that I see in the chat about vaccination efforts. There were first responders who were not inclined to get the vaccine originally, but may be swayed now that the J&J one is out. Those individuals can go get vaccinated as long as they're still part of the 1A priority group, so they can still sign up to be vaccinated at a vaccination site. But kind of what we were saying when we originally said this is now's really your time to get vaccinated. We're not going to do this major push to come find you when you decide that it's time that you want to get vaccinated. So they're going to have to take the initiative to sign up. And they're going to have to take the initiative to reach out to try to get vaccinated. They can sign up. They are eligible. They will receive a vaccine, but they would need to take that initiative to reach out to get vaccinated, because if we have to go back every time, it's going to be a never-ending process. But we strongly encourage them to reach out. Service leaders can reach out to local vaccinating agencies, and those vaccinating agencies can help assist them in coordinating when those people can come in for a vaccination. So that will be the process by which they go through getting vaccinated. If they want to receive a J&J one, then they will have to coordinate with a vaccinating agency. Slowly, we are trying to transition entirely to J&J rather than using Moderna or Pfizer, just because of the ease of use of J&J with a single dose vaccine. And so that is the intention, is to make that transition. But that transition will likely be next month or later, when we have more sustainable supplies. If I don't have any J&J, I don't want to shut down the entire vaccination operation. So so they will have to coordinate with that. But you don't get when you sign up, you don't get a choice which vaccine you're going to choose. So you would need to coordinate with that before you sign up to know that, to ask what vaccine they're giving, because you don't get to choose which one. And most agencies, if not all, will only be giving one at a specific time. They won't have multiple on hand. So when you get there, you won't be able to choose either. So that is important to keep in mind, just as people consider this. Any additional questions, Jason? I see you say from text message. So Jason said, I was under the impression that the Governor Mills opened a vaccination for all teachers, not just 16 above. Can you confirm this? That is correct. Governor Mills did open up vaccinations for all persons 60 plus, as well as teachers, So no matter their age. So that is the case, that they did expand that to allow for teachers, no matter their age, to be vaccinated. Fred from Old Orchard Beach has a vaccination site. We've been contacted by our local school district to vaccinate them. We have doses. Should we advise them to get permission for us to do all of them, or just do it? So Fred, I have been actively working on the back end with this with Amy Belisle in the Department of Education. So y'all are totally fine. All of this has been happening on the back end for you guys. So no worries there. Any additional questions about vaccines before we move on? Okay. Before I go into the BinaxNOW, I'm going to turn it over to Dr. Zimmerman, just because I know she has to jump off at 11, and then, or at 1, and then we will go back to the BinaxNOW.
In a different time zone.
Exactly.
Yeah, I know. I feel like I am some days too. I just want to reiterate everything that Director Hurley has talked about in terms of taking care of yourselves. None of us, I think, are getting through this unscathed, myself included. So please just be sure to recognize your own vulnerabilities and reach out for help, and support those around you that you think may need it as well. In terms of, from the medical director's standpoint, again, maintaining vigilance. We are occasionally, anecdotally seeing folks who are not wearing proper PPE, especially the eye protection. I know it's hard sometimes to remember that, but it is very important. We know that folks are getting busy or busier with call volumes and vaccine clinics, et cetera. Please, again, feel free to reach out to us for any assistance that you may need with that. I don't have anything else specifically on my agenda to talk about today, unless there are any questions folks may have that would be best served by me to answer.
I will interject, Dr. Zimmerman, that kind of relates to you. Dr. Scholl executed a standing order for the Johnson & Johnson Janssen COVID-19 vaccine that basically states that EMS agencies that are authorized to administer the vaccine may do so in alignment with the governor's current policies and procedures regarding who it can be administered to. So that was executed because we have one for Moderna, but we didn't have one for Janssen. And so Maine EMS actually built one last night because we knew that the vaccine was really going to start being administered today in full swing. And so just letting people know that does exist. Vaccinating agencies should have received a copy this morning. If not, reach out to us. We can get a copy of it to you. But we just want to make sure you know that you are covered.
Good to hear. Thank you, guys.
Thank you, Dr. Zimmerman. So back to the BinaxNOW. I know there have been many questions about the BinaxNOWs. Maine EMS has been a little swamped with some Johnson & Johnson education issues, but we will be sending out a memo or a bulletin about the BinaxNOWs this week, so likely either this afternoon or tomorrow. The BinaxNOW kits that you have that are expiring within the next week or month, most likely, depends on their lot number, have been given a 3-month extension for their expiration date. So I know that many of you reached out to me saying my BinaxNOWs are expiring. What do I do? Please note that there has been a 3-month extension based on lot number from the US FDA. And we will be pushing that information out to you in a bulletin. You will need to put a sticker or you will need to put a label on your BinaxNOW saying this expiration date has been extended. So you can write it on there, you can do whatever, but you do need to label it that this expiration date has been extended, much like they would do in a hospital. If they did it for a medication, they put a sticker on there with a new expiration date. So please note that that is something that you will need to do, and we will include directions or instructions to do so in the update about the BinaxNOWs and labeling those appropriately. That said, when we get closer to that 3-month expiration date, if you still have BinaxNOW tests that need to be used, but you only have about a 2 or 3 week window on them, you need to let us know. And so what we can do is we can help get you the information on where to transfer them. So we will be transferring them to Walgreens, FQHC, so federally qualified health centers, and other facilities that are using these for other purposes because they have a higher throughput and a higher utilization rate. So they use more often, they use more of them, and they use them more often than we do, and let them burn through them quickly, and then we can backfill your quantity. So we don't want to throw any of them away, especially as of January 1st, I believe. The state of Maine government is actually buying these things, so it's not coming from the feds. It's coming out of the coffers of state of Maine government. So not that we wanted to throw them away when they were federal government either, but it's really important that we use them if we have them or they get used. So that is something that if you have them that they are coming up on their expiration date, let us know. There is an extension on, I believe, almost on every lot number, but I want to make sure that you verify with the lot number that new expiration date and write it on there. And we will be sending out a bulletin that outlines that and includes all of those lot numbers and new expiration dates. I have received many questions about utilization of the BinaxNOWs based on our previous use case, using these to basically rule out COVID. The positivity rate is somewhat hovering at this point. Dr. Scholl and I have had several conversations about this, but it requires us not only speaking and agreeing, but also we have to have extensive conversations with the Maine CDC, with their epidemiology division, and their infectious diseases division when we pull the trigger. However, I think that trigger will likely be pulled within the next 2 or 3 weeks. So please note that we are working on that, and we that is not just on at the wayside, and no one's thinking about it. We are working on it, but just bear with us. This is a process, and it's kind of like steering a cruise ship with a canoe paddle. Sometimes it takes a little time to turn. So I appreciate everyone's patience with that, and please don't hesitate to reach out to us if you have any additional questions or concerns about the BinaxNOW. We're more than happy to answer those for you. So, Jason, I don't believe there's anything else listed in our update today, but I do want to kind of hit over some of the questions and make sure that I answered all of them, or that Jason answered all of them. I think that Jason has been responding to some of the questions in the chat as we've been going along. Will there be an update to MEFRS adding other groups, teachers over 60, etc.? So for vaccinating sites that do have the documentation or the run form for vaccinations, yes. As Jason indicated, that update will come out today. As we move along, we actually will be changing that again in the future. And we will be taking public safety, like fire, police, EMS, dispatch, and we will be rolling it into public safety. Just because that way we know that the other categories are going to expand, and soon you may have a list of 100 things, and we don't want to make it this like long, cumbersome list. And we vaccinated a large majority of the public safety professionals in the state of Maine to date, and so at that point we would just transition over to a generic variable. But that would be in the future. But just know that there will be continual updates and changes to that as we move along, and we will provide you notice of those changes as they come about. Chief Arnold asks about Block It Now's scheduling. Does that satisfy MEFRS documentation? And currently there is no integration between Block It Now and MEFRS. Remember, Block It Now is considered an intermediary or a temporary solution until Maine CDC has their full solution up. Block It Now does not have the capacity to document a vaccination. It doesn't allow you to document the lot number and all those things in the system. So even if you do use Block It Now for scheduling, you do need to complete a full MEFRS record to document that medication administration. Next question is, are there any new updates as to how long these vaccines last and when people will need boosters? So they are continuing to do research on that. However, because of the novelty and how new they are, we don't really have a lot of great data at this time. They're studying many of the people who received the vaccinations as part of the trials in the phase 1s, 2s, and 3s last summer. And so as soon as we have more information, we absolutely will be we'll be pushing that out to everyone. But at this time, we don't really have a ton of information about how long they last, and if and when people may need boosters. But if we do get that information, and when we do get that information, we certainly will share it with you. is it still acceptable to vaccinate 1A stragglers when it's also acceptable to still vaccinate our 1Bs that we had left, and or the 1Cs expected to be vaccinated next? I'm sorry, let me reread this question. So at this time, vaccinating entities are able to vaccinate everyone they've been able to vaccinate already and the people that the governor has allowed to this point. So you're able to vaccinate doctors and nurses and paramedics and EMTs and firefighters and police officers. You're able to vaccinate any person over the age of 59, so 60 plus. You're able to vaccinate teachers of any age, and you're able to vaccinate anyone going back. So you should be able to vaccinate anyone that has previously been authorized to be vaccinated. Their authorization continues forward in perpetuity. So an ER doctor, say in June, for example, we're going to have a new batch of residents that come in. Say their medical school for some weird reason didn't get to vaccinate their medical school students. And so in June, we have an influx of ED residents here in Portland. Those new ED residents were part of the first wave that were eligible to get vaccinated. They now too will be eligible to be vaccinated, although they're 28 years old, and they will be eligible to get vaccinated. And so, yes, so it goes backwards. You can vaccinate people that have been authorized prior to. So Chris asks, is Maine EMS or the state requiring that fire and EMS staff complete a vaccination declination form if they decline the vaccine? So we are not requiring that they do that. What we did is we asked EMS, the vaccinating agencies who are responsible for vaccinating public safety professionals, to ask the sites that were, to ask the individual agencies to get rosters. From those rosters, they solicited whether or not they wanted to get a vaccination. If they opted to not get a vaccination, the ask was for them to get a declination form. Not to say, oh, see, I have this form that says you didn't want it, but really to say you were offered the vaccine, because we didn't want anyone to be in a position where they said, I wasn't given the opportunity to have the vaccine. So the idea is that everyone on those rosters either has a vaccine next to their name or they have a declination form next to their name. So that way you know that every person on every roster was offered the vaccine. That's the intention. However, even if I signed a declination form today or right now, this afternoon, if I change my mind, I can go get you would be eligible to go get a vaccine. So the declination form doesn't mean anything as far as whether or not you're eligible to receive a vaccine. The only thing it's used for is to determine that you have been offered the vaccine and that at this time you made an informed decision that you didn't want that. And that is totally fine. That is a personal decision for each and every person to make on their own. So yeah, that's how that works. I'm more than happy to answer any additional questions. I know I'm not that good that I answered all questions as part of my rambling, but please don't hesitate to put some more questions in the chat. I think we'll stay on for a few more minutes and we'll answer any additional questions. I will go into my little spiel about thanking everyone while we wait. But thank you all so much for joining us today. I know that this takes time out of your busy schedules to join our meetings. Again, if you are interested in becoming a vaccinating agency or participating in vaccination efforts, please let us know. We'll be more than happy to help facilitate and assist you with going through that process. as many of the vaccination agencies will tell you, it is a process. And getting familiar with the system, understanding impact, understanding the documentation systems. It's a process. And so we would love to have the opportunity to work with you to facilitate that. It is important to make sure that you take care of yourselves and remind your members that whether or not they've been vaccinated, PPE is still required. I know no one likes that. And I know that as more and more people become vaccinated, they will become more liberal, per se, with their social behaviors, as far as, oh, I've been vaccinated, I'm fine going to dinner, which that's fine too, but I'm fine going to this party at my friend's house where there's 10 other people that I don't know, or whatever it may be. Just please remind people that the vaccines are not 100% effective. No vaccine is 100% effective, or most vaccines are not 100% effective. And just please keep that in mind. We would hate to see an outbreak because we lose sight of PPE vigilance. And it's important to note that at almost every EMS agency, there are people who either A, had allergies, B, just decided to opt out, C, had other objections to getting a vaccine. And so there are people who are susceptible or more susceptible at every agency. And so if you, it is important to keep that in mind. And so maintaining that PPE vigilance is something that we need to maintain going forward, because it's still there. And as Dr. Fauci pointed out, it may be next year before some of this vigilance really is able to subside some. But again, that is all dependent on herd immunity and how many vaccinations we can get in arms. And so huge kudos to all of the hard work that our vaccination teams are investing right now in achieving that goal in collaboration with other partners throughout the state. Please take care of yourself. Please take care of your members. Don't hesitate to reach out to Maine EMS if there are additional questions. Use your peer support systems, your regional offices, the Frontline, Warmline, and other national features. Thank you all so much for joining us. We really do appreciate you taking the time. And please do not hesitate to reach out to us if there are any questions, comments, or concerns that Maine EMS can address at any time. Thank you and have a great day.